Good afternoon, Mr. Chair and members. Karen Lang on behalf of the Sonoma County Board of Supervisors. They have three major concerns, one being the shortened timeline because of the concern for the people that live there. The community that we're talking about in Sonoma specifically is very rural, and there is not the same type of infrastructure that would be available to residents in an area like Agnews or Lanterman. So they need a longer period of time to develop the community services in order to move folks out. They secondly are very concerned about the number of employees that would be without a job at the developmental center. And thirdly, the land is an incredibly important part of that area in the county, and they would like to be a part of all of the discussions related to the people, the employees, and the land. And for those reasons, they're concerned today, but look forward to working with you all. Thank you.
We welcome the County of Sonoma to be a part of that stakeholder group. Thank you.
Hello, my name is Aaron Kitzman. I'm at Villa Esperanza Services. We're a community service provider. I want to especially thank Chairman Thurman for your opening remarks. The community service system is falling apart. It's slow, but it is happening. I want to try to urge all of you who support the community system to speak with your fellow elected officials. As you're probably aware, Senator Bell wrote a letter requesting a 10% increase. Last I heard, there were 64 people who signed on to that letter. Signing the letter is easy. Now we need you guys to go out and be our voices and speak with your fellow, your peer group, and get them to talk to the governor, because the time is now. As you've heard, there are providers who are closing. I know my company's starting to close some programs as well. We cannot wait any longer. It's been too long. Thank you.
Thank you.
Good afternoon, Chair. Tony Thurman. I heard your 30 seconds, so I will do it. On behalf of the Lanterman Coalition, I want to thank you for the very, very powerful opening remarks. I think that was very clear to our community exactly what you said, and I appreciate that so much. And we also note that the administration is making some bold moves with the developmental centers. It's not the plan, but it's part of it. And so I want to recognize that as well. But the 10% plan from the Lanterman Coalition, again, thank you for your support.
Thank you.
I think I got it. Good afternoon, Margaret Johnson with Disability Rights California. We are pleased with the administration's plans to begin a comprehensive process for transitioning developmental center residents into the community. We're also really pleased and want to encourage the investment in community service systems. And then we have two areas we're in opposition. One is the use of capital outlay. We would suggest instead that money be put towards community programs. And secondly, we're opposed to the expansion of the Porterville beds for incompetent to stand trial, and would instead encourage that community programs with secure perimeters be looked at instead. Thank you.
Thank you.
Thanks. Mr. Chair and members, Rick Rollins here on behalf of ARCA, the Association of Regional Center Agencies. We want to add our voice in strong support of the administration's effort on the closure of Sonoma Developmental Center. ARCA has a long-standing policy of moving folks into the community in a safe and positive way. We'd also like to go on record in support of the Shannon's Mountain proposal as well. Thank you.
Thank you.
Good afternoon. Bob Giavotti with the State Council on Developmental Disabilities. We are part of the Lanterman Coalition as well. We certainly appreciate the difficulties in trying to balance a number of equally laudable goals. Where does the money come from? But we do feel that in light of the many legislators that signed the Bell letter, it is time to take a serious look at where the money is going to come from and think about the folks in our community that are disadvantaged and need our help. Thank you very much.
Thank you.
Marty Moto, California Disability Senior Community Action Network, CDCAN. I'm also a family member. My sister had developmental disabilities when she was alive and was in the system. I just want to first applaud the administration for its plan to transition people out of the developmental centers, and appreciate your remarks, Mr. Thurman, that it be done in a just and fair way. That's really important. Secondly, also appreciate your remarks regarding that we are one community system, whether we're regional centers, people in the community, family members, people receiving services. We are one system, one community. And toward that, just urge targeted funding, help we desperately need, especially in the area of caseloads, especially in the area of minimum wage for exempt staff, sick leave for the providers who are providing it,
Thank
and
you.
also some limited help for health care benefits and maybe even wage enhancements for staff. Thank you.
Thank you.
I'm too short. My name is Beverly McClure, and I used to live in a group home, and it's not like a home. When you live in a supported living, it's more like a home. And I love it more than anything. If I didn't live in a group home and I see what happens, it's more experience that you could live on your own. They help you cook, they help you clean, they do a lot with you.
Thank you very much.
You're welcome.
Mr. Chair and members, Kobe Pizzati with California Association of Psychiatric Technicians. I'd first like to thank Mr. Bonta and Mr. Chu for their comments that they made. Also, I'd like to echo the comments of Ms. Lang. As one of the testifiers said that providers are closing down, we would just like to say it would be important to us to eliminate the time frames that have been set forth in the May Revise, so as to not rush individuals out into the community before the supports are ready. Resources need to be established and support systems need to be in place before a time frame can even be addressed. Secondly, before any funding goes out into the community, we should make sure that a robust community state staffing program is in place before any closure takes place, so that vendors must participate in this before they start receiving resources. Thank you.
Thank you.
Good day, everyone. My name is Juan Nolasco. I'm the state president for the California Association of Psychiatric Technicians. I represent about 1,000 members that work with developmentally disabled. I want to strongly urge that we don't rush through this process, that we look at all avenues and consider alternatives, and we want to be able to work out through this process. Thank you.
Thank you.
Good afternoon. Thank you, Mr. Chair and members. Mark Vittorio with ASME Local 2620, representing about just under roughly 300 members that work within the developmental centers. Want to say thank you to Assemblymember Bonta and Chu for their comments as well. We think that this artificial timeline is really not the way to go, and really should be, echoing their comments, is looking at what's right for each individual client that's being served right now. So, and also echoing the comments of Kobe Pizzati from CAPT as well. Thank you.
Thank you.
Hi, my name is Janelle Copenhaver. I'm a developmentally disabled adult through Far Northern Regional Center. And I want to talk about, I don't like Porterville Developmental Center. I was there 14 years ago and I was abused horribly there. And I came out into supportive living, and I've been successful for 14 years out here with my services. So I want the 10% raise. Thank you.
Thank you.
Hi, my name is Jackie Dillard Foss. I'm with the STEP program, employing 630 employees who would really love to have the state robust compensation program today. So I think I get offended when I hear that we must make sure the state employees are taken care of when our community-based employees are struggling right now. Hundreds of thousands of them. Let's take care of them. I don't want to hear it again that we need to take care of I would love for them to stand beside and say, can you take care of the community-based employees too? We don't hear that conversation.
Thank you.
And we do it. We do it, and we do it well. So
thank you.
I'm going to...
We hear you.
You'll hear me some more.
Thank you.
Wait, she said, hold on, I got to get to this. Hold on. Can you get there?
Thank you very much. I'm probably the 10% too.
What do you want to tell them?
Yeah. The big thing.
You want me to say what you just told me?
Yeah.
This is Debbie. Debbie lived at a skilled nursing facility for most of her life, and she's been in supported living for 5 years, and she said her biggest fear is going back into a nursing home. She's a hiring manager at STEP. She helps to hire employees. She helps vet them, and she's an extraordinary woman who deserves her right to live in the community, and she shows we can and we do.
Thank you for your work and your testimony.
Hi, I'm Dick Fitzmaurice, president of the board of the ARC of California and a parent. My son had cerebral palsy. Couple things. One, thank you for your opening remarks. They were right on target. Two, the 10% increase is absolutely critical. We have chapters every day trying to make ends meet and still trying to do the job of helping the people that we serve. And three, I think you definitely need a timeline for closing the developmental centers. A timeline with flexibility, perhaps, but you got to have a timeline or you'll never get them closed. Thanks.
Thank you.
Hi, Joan Schmidt. I'm a parent of a 42-year-old son with autism who's been in supported living for about 20 years now. I'm also a provider, and I just want to thank you for your opening remarks, for Member Shannon Grove and for Tony Thurmond, and for supporting what we know is working. The one positive thing we have is a real good model that we know works for everybody. So thank you for supporting that, and we really look forward to which we know we're getting, our 10%.
Thank you. Whatever your crystal ball is, would you please share it? Because we could use it on some other areas too.
Hello, my name is Elizabeth Drake. I am an employer advocate at the agency called STEP. I have cerebral palsy. I have the privilege of living and working in my community. The people still in the DC do not have that opportunity, but yet the state keeps investing millions of dollars into them. It is time to close the DCS and invest that money into the community. The work and care that is done in the community by direct support professionals does not compare to the DCS. My staff does the same exact job and as the state employees in the DC Center. Matter of fact, they do a better job. My staff does not even get paid half as much as those state employees are doing the same job. This is not right. The time is now to invest in the community and support the 10%. 10.
Thank you.
Chairman Thurmond and members of the committee, my name is Jim Burton. I'm Executive Director of Regional Center of the East Bay. I want to extend my thanks to the chair for his strong comments at the beginning. We are one system, and we appreciate your comments. I also want to express our strong support for the administration's proposal on the closure of developmental centers. Thank you.
Thank you.
Hi, my name is Nancy Chance. I'm a supported living, independent living, and day program provider in the Sacramento area. I'm also a family member of a person with a disability. I am running a little late, so I'm not sure what everybody else has already said, but I did want to say that, of course, we in the community are in favor of higher wages for our staff, of overtime for our staff, but we have to be funded in order to do that. We don't have any options otherwise, so that's really important. So I'm in favor of targeted reimbursement. I'm in favor of looking for answers and solutions to problems. I think that the community providers who have been providing sick leave all this time should get the same reimbursement as the people who weren't. Basically, I think that there are solutions out there, but we have to work together to find them, and the community does need the support. Thank you.
Good afternoon. My name is Stacy Sasson, and I'm a director of programs at an agency here in Sacramento. And even though I predominantly deal with the administrative side of things on a daily basis, the last week or so, I'm really thankful that my background is in nursing and psychology, educationally speaking, because I've had to spend a lot of my time trying to comfort employees who think that any day now they're going to lose their jobs, and trying to comfort people who we support who think that they're going to lose their homes and be back into a DC situation or a skilled nursing facility. So with that, it's really difficult because even with all of my educational background, it's hard for me to explain to them why the governor has once again turned his back on this population despite their efforts. They're out here every time there's a budget hearing and explaining why they need this and why they're deserving of it, and the governor turns his back once again. So I'm here to say please, please, please stand up for them, stand up with their direct support professionals, and stand up in support of the 10%, because anything less than standing up for them is both fiscally and morally irresponsible. Thank you.
Al Milan. I live here in Sacramento area with my daughter Molly. My wife and I have cared for her since the day she was born, and we will continue to care for her till the day we die. What happens after that is why we continue to come to every gathering here at Sacramento over the last several years. I'm also, I'm a member of the 29 percenters, so I'm here to speak on behalf of that idea, because the Lanterman Coalition for 10% absolutely needs to be done, but what was stated about the past years is true. I also am on the board of directors of Becoming Independent in Sonoma County, where we used to serve over 1,300 individuals. As of this year, we're right around 1,000, and over the next year, that number will drop considerably. So we really appreciate the comments of the committee and also support the 10% increase. Thank you.
Thank you.
My name is Jake Alvord. I work in supported living services also. 1991, I transitioned first person that I ever knew from Camarillo State Hospital down in Southern California. I just don't want you guys to forget, people will drag their feet when it comes to bringing people out of DCs, and it's really important to happen. And also, you can't think about one thing without the other. The money that you invest in the community, that's going to pay off in tenfold. You're not going to have people winding up in jail, in nursing facilities and places like that. They're going to be in the community. They're going to be supported. They're going to be happy. You can't do one without the other. They have to happen at the same time. You have to support supported employment. I've supported living services out in the community in order to make that happen.
Thank you.
Good afternoon, everybody. I'm Mason Sisson. I'm with the Supported Living Agency based out of Sacramento. I just want to let you know that I'm scared for the people that we support if we don't get this funding. I'm in support of the 10% budget increase. Thank you.
Thank you.
Hi, I'm Julia Colvord. I am one of the behavioral managers at STEP Agency, the SLS service provider. I guess my main thing is we need a timeline. I've successfully, as a behavioral manager, dealt with high behaviors and been able to successfully transfer referrals over within a half a year period to 3 months to 6 months very successfully with great supports, with everything being in line for that transition to happen from the DCs. So, and I support the 10 for 10.
Thank you. So this concludes public comment. I want to thank all of our speakers for coming today and sharing with the committee your great advocacy and your passion, and for organizing on behalf of individuals with developmental disabilities. We thank you. Thank you to our panelists. You're dismissed for now. As we welcome the next panel to come forward from Healthcare Services, Member Grove might have another question for you, Mr. Rogers. A question for you from Mr. Grove as the rest of the panel comes forward. The healthcare panel can come forward. Go ahead, Ms. Grove. Mr. Rogers, I'm sorry. I was trying to do two things at once, have the healthcare panel come up, but if you could stay one hot second, Ms. Grove has a question for you.
I just want to know, there's 321 people in Sonoma right now? 300 and...
Close, 400.
There's 400?
Yes.
So for 15-16, there's going to be 300, or there's 369 people projected?
I can... let me just give you that information. Somebody's listening.
So over a period of 3 years, that'd be like 120 people a year they'd have to move out.
It would be, there are a number of people already in some kind of transition.
Okay.
But that's one part of the math, but we can give you an estimate.
And in your history of closing down the facilities that you've closed down, did you move out more than 100 people a year?
That's what it looks like on the surface, but what I'm trying to explain is that part of the planning that will go on will include some other kind of transitions, most of which we'll be bringing to you updates on what some of those opportunities are. The other part, Ms. Grove, is that there are going to be some ideas that are coming from the community that will be different than our other closing plans.
Thank you so much, sir.
Okay, you're welcome.
Thank you. We welcome the health panel to come forward. Issue number 1, hepatitis C treatment costs, and we'll move through a number of health-related items.
start? Sure. Mary Cantwell, Department of Healthcare Services. I'll start from the perspective of DHCS. So with respect to generally what's happening in this budget proposal, originally, as we discussed in prior committee hearings, the department has always been carrying a certain level of hepatitis C drug costs in the estimate. But in addition to that, the governor had a $300 million set aside in the January budget to account for the fact that there was a lot of uncertainty in the estimates in each individual department. The Department of Healthcare Services, along with other departments, has now had portions of that $300 million allocated out to each individual department. And so now we are currently estimating about 3,000 to 4,000 individuals being served in the Medi-Cal side of the house for these hepatitis C drugs. With respect to the updates on the costs and the rebates, the cost of hepatitis C drugs, of course, still remains high. However, with competing drugs entering the market, manufacturers have been more willing to negotiate supplemental rebate agreements. DHCS currently has an individual supplemental rebate agreements for both drugs made by Gilead, Sovaldi, and Harvoni. It only currently applies to our fee-for-service and county organized health systems, and we're currently working on negotiating a supplemental rebate for the other MCO plans per last year's trailer bill that authorized us to do that. On average, we're looking at about 46% combined in federal and state supplemental rebates. In terms of the question about following the AASLD guidelines, what the department has proposed is an update to our guidelines that are based on essentially two national guidelines, including that one as well as the Veterans Administration. The primary change will be to authorize treatment for stage 2 hepatitis, expanding from the treatment criteria of stages 3 and 4. There's also conditions where treatment would be authorized for any stage. That would include women with chronic hepatitis C who wish to become pregnant or those who are co-infected with HIV. I'll defer to my other department colleagues on their issues.
Stephanie Clendenin, Chief Deputy Director for the Department of State Hospitals. Department of State Hospitals is requesting $6,285,000 in ongoing general fund support to reflect the utilization of the new Hep C treatment drugs in our state hospitals. In prior years, the drug therapies for the treatment of Hep C caused a number of side effects, including psychiatric side effects. They had high drug-to-drug interaction rates, which made it difficult for us to treat our population. So historically, we've treated a very small percentage of our patients. The new treatment protocol, which includes the drug Harvoni, has much fewer side effects and lower drug-to-drug interaction rates, thus making more of our patients eligible to receive treatment. We've developed treatment guidelines that align with the current American Association of Study of Liver Disease criteria and provide for treatment of the highest priority category from those guidelines, which includes those with advanced liver fibrosis, organ transplantation, and some other unusual medical conditions. And then we're also treating the high priority from the AASLD guidelines, which is the F2 stage liver fibrosis and individuals with coexisting conditions such as HIV, Hep B, and type 2 diabetes. We also are providing we have a provision for treatment of patients based on clinical judgment, and that's for our patients who are at high risk of transmitting hepatitis C due to the behavioral and judgment impairment as a result of their severe mental illness. We have approximately 1,000 patients with Hep C in our system, and of those, approximately 250 will meet this criteria for treatment that we've established in the guidelines. We assume that approximately 30% of those eligible patients will consent to participate in treatment, with the total cost of $6,285,000 in the new year.
Public Health.
Hi, Nikki Dillon, ADAP Branch Chief with the Department of Public Health. So the Office of AIDS estimated a net cost of $6.5 million to treat HCV co-infected ADAP clients regardless of liver disease stage in fiscal year 2015-16. ADAP will utilize available rebate funds and federal funds. There's no general fund appropriation for ADAP in fiscal year 2015-16. The ADAP Crisis Task Force, which the California Department of Public Health Office of AIDS is a member, successfully negotiated a supplemental rebate agreement with the manufacturer of the Vicera Pack. As a result, the Vicera Pack is available at a lower cost to ADAP than the other recommended treatment options. OA, in collaboration with the ADAP Medical Advisory Committee, updated the ADAP prior authorization form for HCV treatment. The prior authorization form prioritizes the use of the Vicarapac due to the lower cost among eligible patients when the regimen is equally effective and no medical contraindications to its use exist. Clinicians who wish to treat their ADAP clients with a hepatitis C drug other than Vicarapac must provide a clinical justification. The Office of AIDS is committed to ensuring that all hepatitis C infected ADAP clients have access to hepatitis C treatment medication that is appropriate for them.
Thank you. Department of Finance? Nothing? Okay. LAO? Okay. Let's go to members of the committee. Assemblymember Chu.
Thank you, Mr. Chair. I wanted to just make a couple of observations about the latest results regarding the revise. First of all, I want to thank you, and obviously it's a good trend that we've been able to bring down these costs somewhat. That being said, we know that the money that's been allocated for this budget will only be able to take care of 3,000 to 4,000 hepatitis C patients, when we know statewide the estimates are around 750,000 Californians that have some form of hepatitis. I will also like to just ask a question. I've heard that rates have gone down by 46%, and yet the numbers we're still talking about have dropped from $300 million of expenditure down to 228. Could you give a sense of why things didn't drop further than that?
Sure, I can speak for the Department of Healthcare Services. We actually budget drug rebates in a separate item. So we have seen our drug rebate estimates go up, and we can certainly make sure that that is clear to you and provide that to the committee, how much those have gone up. So what's reflected in our particular policy change estimate for hepatitis C does not reflect the rebates that we are getting. That is reflected in a separate item.
Okay, and I know there's a working group that's looking at some of these high-priced drugs. Could you give us a little update on the activities of that working group?
So that is being run. Oh, there, yeah. Okay, here from our agency.
Excuse me, bit of musical chairs down here. Hi, Katie Hydorn with the Health and Human Services Agency. We do have a work group that's been digging into these issues, both with our state partners, our local county partners, and also with external stakeholders. So we sort of did a universe look earlier this year between January and now, and we intend to continue those work groups, both with our state and local partners, but also with our external stakeholder groups. Specifically, we're looking at clinical issues, but we're also looking at procurement issues as well. And as the May revision, 8 pages state, we're looking at something for the 16-17 year. Thanks.
Great. As you know, this is an area I've been very interested in. We have a 2-year bill on this topic. What I would appreciate is if you could contact our office, and I think if possible, we'd like to be involved in that working group, or at least be kept abreast of your developments.
Absolutely. Thank you, sir.
And if I could just give one sort of framing comment, this money is incredibly important for our hepatitis C patients. That being said, if we didn't have the high costs that we're talking about, and I know this is something that our colleague, Ms. Grove, has also been focused on, we could, for example, restore almost all of our Medi-Cal reimbursement rates. We could have an option of extending Medi-Cal to all Californians, including immigrants. We could have an opportunity to start to think about backfilling optional benefits in many areas that we've heard of here on this committee, including for Denti-Cal or for acupuncture. For me, really getting a handle on the particular exploding costs in this area and others is something that's very important. So again, I appreciate your work on this, and we will continue.
Thank you.
And I just want to build off that final comment by Assemblymember Chu. The delta here that's no longer being programmed towards Hep C treatment, the $72 million, has that been reprogrammed to a specific purpose, or was it kind of all put back in the kitty and sent out into different directions? My question is because I didn't see a lot on anything on Medi-Cal reimbursement rate increases, and that might have been a good foundation to start on that.
Yeah, Department of Finance, Jamie Matalka, that money is just back into the general fund for all of the other purposes that the general fund is used for.
Actually, if I could just follow up on that. So there wasn't really consideration given to, again, bringing back Medi-Cal rates or an expansion to all Californians, including immigrants, or some of the really, I think, desperately needed additional Medi-Cal benefits.
Yeah, I would think that the administration's May revised proposals has everything that they wanted to include in it with general fund purposes.
Okay. Thank you.
Let's go to public comment.
Good afternoon, Mr. Chair and members. Tam Ma with Health Access California. We've been very supportive of various proposals to make high-cost drugs more accessible and affordable to consumers. We do believe that the state's strategy around high-cost drugs and hepatitis C treatment needs to include efforts to reduce new infections. This is something that we've done with HIV and AIDS, and we believe that it should be done for hepatitis C as well. We appreciate the opportunity to provide input with DHS's proposed clinical guidelines. Look forward to reviewing those. And finally, the May revision states that the Health and Human Services Agency is going to convene the work groups on clinical and procurement issues, and we very much appreciate the continued participation of health and consumer stakeholders in those work groups. Thank you.
Good afternoon, Chair, members. Linda Way with Western Center on Law and Poverty would like to ditto the comments of Health Access as well as state that we support the proposal to increase funding to reflect new guidelines in the Medi-Cal program, but have heard from legal aid advocates that providers on behalf of consumers have reported difficulty obtaining approval for Hep C drugs from Medi-Cal managed care plans due to different interpretations of the clinical guidelines. Advocates have asked DHCS for specific data and have yet to receive that, but we do look forward to working with the department on commenting on the new clinical guidelines.
Thank you, Mr. Chair and members. Nick Luizos on behalf of the California Association of Health Plans. Obviously, we're supportive of the state covering its costs in this area. We do find it worrisome that the state is putting $250 million down as a supplemental payment for just one class of drugs dealing with one disease. And the state is signaling that there are more costs down the lines and potentially in next year's budget, and that we should be collectively working together to try to explore solutions. We want to continue to be a part of that process. We appreciate HHS for including us in the stakeholder meeting that happened a month or so ago. We do believe that as a part of that process, there should be more transparency around the underlying pricing of drugs and a comprehensive look across state programs to get a real look at which populations are affected and what the budget implications are down the line. You know, the pipeline for new drugs is getting jam-packed with a lot of costly drugs that will be introduced into the market. And the state could be seeing billions of dollars in exposures as a result. So, we think there's a remaining problem here with respect to affordability and potentially access. So, thank you.
Thank you. See no further public comment. I think we can go to our next item. The Department of Health Care Services, issue number 1, Medi-Cal estimate may revise adjustments.